trauma is a major cause of death, and it's a major cause of death particularly for younger, healthier people. Although road safety has got better over the years, it's still literally hundreds and hundreds of deaths a year in this country. Many of them because people bleed after trauma. And what this drug does is it enables you to reduce the risk of death from bleeding if you get it in quickly.
With major trauma cases now, we have an extra tool in our kit really to bring to our patients who are the most critically injured or unwell. The first clot's the best clot, so with the tranexamic acid stabilising that, it means that we can prevent further bleeding in our most critically unwell patients. Minutes count when you're critically injured.
This fantastic big international trial showed that if you gave it to people who were at risk of bleeding after trauma, it reduced the risk of dying by about a third. What makes it even more amazing is that it's an extremely safe drug and extremely cheap. That is the most wonderful combination in medicine. We don't often have interventions that are cheap, effective and safe.
Working with PenArc has been fantastic. We have collaborated for a number of years on a range of different projects, but TXA was the first project. I think we're very lucky, regionally and nationally, that the NIHR, the National Institute for Health Research, fund PenArc because actually it makes a difference to patients. That's the most important thing from our perspective. Research doesn't just sit on the shelf, it actually makes a difference if you implement it. So investment in research is really quite important for patient benefit.
Hundreds of lives are being saved every year in this country simply because NIHR invested in evidence and relationships.
To see how something's being developed, how it's going to work, is it safe, is it effective? Improving practice for paramedics and developing the role that we do is brilliant.
It actually makes a difference in paramedic practice because they can see that it's a treatment which benefits patients in real time.
Probably the most important thing we've learned is that relationships are the heart of all of this. And actually, if you can have the right relationships between people who understand the evidence and know about the evidence and the people who are going to use it, you produce interventions that make sense on the ground.
For me, it's about connecting research and people together. Patient involvement keeps research to real life. When people contribute in study, they will bring their own experience.
It's hard to underestimate just how enormous an impact this has had around the world.